And there's a place in that discussion for everyone. You know, you don't have to be Black or a Black male to see that people getting stomped down in the streets for just trying to get some air is not okay. You know, you don't have to be a woman to understand that people need access to healthcare and abortion access. You don't, you know, there, and it goes on and on. You don't have to be an immigrant from the global South to realize that it's not okay to lock little kids up, and women and families and people who are escaping horrors. We shouldn't expose them to, you know, so you don't have to be a member of any oppressed group to stand against oppression. And I think it's about letting this time really get that through to us and see, and really feeling and understanding that. Because yeah, we're all feeling vulnerable now, but a lot of people have been vulnerable, and going back to the old way, that's not it. So how can we do that?
That was my question. How do you think is the best way of like being also like actually helpful in some ways, especially of course at a distance now, but like maybe once eventually we can start going back? What do you think are the best ways of like being helpful?
Carlottta, I'll let you
talk a little bit about that.
Yeah, because talk about your experience organizing and your work.
So people have like a background. I'm a nurse, and I'm like the nurse director of the clinics, the Bureau of Sexually Transmitted Infection clinics. And a lot of like what I've been doing the last few weeks is making sure that like the people that I work with feel comfortable going back to work, and like have adequate protection while they're going back to work. And so I think like checking in with like each other to see how people are about going back to work, or going sort of like facing this, is a really important thing. Like the individual connection is going to be huge, and that's something like we could really improve upon here in the US. But I think mutual aid has sort of been like the biggest thing that I automatically think of in terms of like, there are ways that you can be involved in your community. So whether it's, for example, like, you know, getting on a Slack channel for your community to see like, okay, who can I help make sure that they have groceries if they're too scared to go to the store, or who can I even like just check in with to see how they're doing mental health wise. But I think mutual aid is just going to be huge. And like in New York City, like we've shown that like there's so many ways people can be involved, even if it's like on a small front, from like delivering food. And we've seen like Alexandria Ocasio like is doing that. But like, I think just making sure like you and your neighbors and your loved ones, do they have what they need right now? And that's the basics, right? Like Maslow's hierarchy of needs is basically saying like, do people have food? Do they have shelter? Like, how are we going to move forward to make sure that like all New Yorkers have that?
Yeah. I mean, it starts from the bottom up. You can do anything if in your world, whatever makes your world, the people who make your world, your job, where you live, where you socialize. If in your world, are you being a change agent? Like, are you, standing up for right in those moments? Are you thinking about other people who may be in need? Naomi was asking a question about being out in, starting back work and feeling like a non-essential person, like your work is non-essential, but knowing that the work that you do is essential. If you're working out there and you're feeding people, that's essential work, and it's valuable work, and you should be getting paid a living wage for that work. I think that, wait, one second.
She's also asking, would you advise against small businesses reopening within the parameters of safety during this time? Like, I think for me, like, that would really depend upon, like, if the organization or if the business, for example, like, was able to provide adequate protection or able to provide 6 feet of protection, like, for its workers. And if that was, like, a value of theirs, like, like, even me going out, like, ordering food, yesterday I saw that there was the one place that I ordered food from, like, no one was wearing masks, right? And, like, I took a minute and I was just like, hey, like, I really think it's important for, like, as a nurse, I want to make sure you protect yourself as well from, like, the customers that are coming to you. Because, like, maybe inside of your space, you're able to maintain 6 feet of distance between you and other coworkers, but maybe you're not. And so maybe you need to, like, have these conversations of, like, what could that, let's have honest conversations or open conversations about, like, how are people going to feel safe about going back to work? Like, is it going to be gloves, masks, and, like, lines in this, you know what I mean? Like in the common areas, so people know that they need to maintain 6 feet of distance. I think it's up to like every individual's having these conversations and
It's
speaking
about
to their
feeling
needs of
empowered.
safety.
Yeah. Feeling empowered to do that. And who knows, you may be the person at work who is doing the good work of like, hey guys, we actually should distance, you know? We should be all wearing a mask. If no one's enforcing it, somebody should, you know? And if you're able to, you know, feel empowered and say, hey guys, you know, we're out here, we're risking our lives. This is a dangerous and weird time for all of us, but we should do our part to keep ourselves safe so that we can be good for ourselves and we can take care of ourselves, but we can also help out our families. We can help out our community by doing this essential work, and we can not get other people sick, you know? I think that there's a place for all the work, and I think picking a mindset of trying to be positive and trying to be a positive force and trying to be a change agent and trying to advance these things that we stand for and that we believe in. I think, you know, asking yourself, like, what have I done today? Or like, what am I doing? Or do I have a side project or a main project that's, you know, that's values based, you know, and that's like helping people, or that's like putting something positive out there in the world. And just taking that moment to just, if everyone, you know, had a thing that they did, you know, I think the world would be a better place. I think there's that, and I think there's a bigger thing that needs to be talked about, which is like a bigger movement to raise a critical consciousness among people and voters so they can see that a lot of the things that are going on can no longer be marginal issues. These things are the core of, you know, of human life. You know, these are core necessities, healthcare and a living wage. And we can't be, you know, I don't think things, we've seen of so much change since from this coronavirus that nothing's impossible anymore. I don't think that universal health care is impossible. I don't think something better than some system that uses insurance companies that are nickel and diming people. I think that we can move beyond a system that has that. Why not? Look, we've been through a lot, and we've seen a lot of weird possibilities play themselves out. And we could, I think, having a movement and talking about these things as vital and essential and non-negotiable, I think we can raise a critical mass. I think a lot of people can see that it's been for way too long, way too fucked up.
And I think I just also wanted to like add to the person who had that question in the chat room. It's like, talk to your other coworkers and just be like, what do you guys need to feel safe and secure coming back to work? And like, you know, it's a matter of like really just getting to the bottom of like, what are people's needs to feel safe to go back to work?
Yeah. Any other questions or comments? Anything else, guys?
There was one question I saw that said, considering we are really in the infancy of this, like you're saying, is there any way to know when it might be safe to stop social isolating in New York City? Do you have any predictions about when that might be? I don't know, we talked about it a little bit. But.
Yeah, I think we're going to be isolating or in some version of isolation for a long time. Who's to say? But I think it would be prudent to isolate until we know that this thing is something that's not in the community in such a sustained way where like you can just literally just pick it up outside the street. If we can get this thing where we can get it just to sick people in hospitals or sick people isolated, then we can talk about distancing. But until we're at that point, at that point, we shouldn't be thinking about, it may not be as strict, but I think it will be prudent, like if you don't know someone, to not be up in someone's face or be in a crowded club or a crowded, stadium.
Yeah, and so what I would also like add to that is like I think it is overwhelming to think that you're going to be social isolating for a while, but like what I'm trying to do is like sort of keep my circle of people that I'm interacting with like very small. So I only interact with like my roommates and one additional person, like who's also like living by themselves, not interacting with other people. And so like I think you can go out, but like be very cautious about like who's in your social circle, because like the way I'm thinking about it is like if I got a call saying you've been exposed to COVID or you have COVID, where have you been the last 30 days and who have you been hanging out with, or what places have you frequented, I would be able to run through and give them names and run through the locations I've been in. Like just as much as possible, try to limit and not do as, you know, like maybe not go as many places as you used to go, like don't go as many places as you used to go before. I think in terms of like to my own self, like the way I'm trying to hold myself accountable is like, if a contact tracer did come and was like, gave me a call and was like, where have you been? I would be able to tell them it's only, you know what I mean? Like my roommates and maybe one or two additional people that I've seen.
Or also, if you got sick, you would want to be able to know the people you were in contact with. So you could say, hey, the 3 people I've talked to, you need to like actually like watch out. I'm having symptoms. I'm going to get tested. And that's the way you can kind of control this thing. Because in the old world, we'd see so many people, it was almost impossible. But now, because of these restrictions in our movement, we're actually really able to really modify how much interaction we're having with people. And it just gives us that much, we're just that much more effective if people are actually isolating to find out, oh, these are the 5 people you've been around. And we can actually probably believe it more than in the old world where you've been on a train, you've been in a bus, you've been in 8 elevators all day. And so even it's for our own selves, for the greater good, like this distancing and isolating are good, but distancing is going to be along a lot longer. I don't know about isolating.
So there's one question from Andrea. Says, are there specific organizations that you trust, respect, and would recommend we partner with?
There's so many. You can find these organizations online and Instagram. You find a lot of like, proactive organizations that you can trust. See what they're doing. Go to their websites, follow them on social media, see what they are doing. Some of them are writing things that, people who are big out doing the work, you can partner with them. There's so many places. Just find a cause that works for you, or one that you think that your skills would be the most beneficial or have the biggest impact. The biggest thing is just do. You'll see that once you start doing, it's easy to just keep doing it. But the startup is the big barrier for a lot of people. So just finding one, or making your own if you feel like you want to like get your voice out there and talk about things. That's another option. But listening to a talk like this and spreading the word about, what we're trying to do and trying to raise some consciousness and spread information, that's a help. The APOL community is a great spot. Go ahead. Mm-hmm. Sorry.
I would say like Google like mutual aid and maybe like your neighborhood in Brooklyn, or and just like go from there, to see, because there's definitely like some mutual aid groups that are like more active. And like even like when I walk around my block, like it's really inspiring just to see signs on people's doors like, hey, you know what I mean? Like text this phone number if you need help with groceries, because I'm here to help you. Like you could do something like small like that, even in like the building where you live.
Yeah.
And then maybe that like something else, like just like came to my mind, like maybe Julian and I can like put some stuff on our Instagram page, so you can follow us at People's Clinic NYC, and I'll put that in the chat too, because we can post some other things on our Instagram after this as well.
Yeah, for sure.
And there was one question from Allison that she sent me that I put into the group. And so it was like, do you think that the new cases of children getting sick, which may be related to COVID-19, will change the trajectory of reopening?
No, it seemed like a pretty rare occurrence. So not too long ago, there were a lot of reports coming in of children developing this illness that was consistent with another illness. It's called Kawasaki's disease, basically like a vascular disease that can affect the heart. So you get little kids who get really sick and high fevers, sometimes like rash, and basically they come to the hospital and they found that some kids, there's been more incidents of this virus, or this presentation rather, of Kawasaki disease than normal. And some of the kids who are presenting with it than like in normal times, where they would get maybe 1 or 2 a month, and an ICU will have like 10 now, where that's kind of like a lot. It's just not the normal range. And so they're looking to see, is there a correlation? Some of these kids have come back positive, some of the kids have not. And so they're like, is this from COVID? Is it not? time will tell. It's not like a thing where tons of kids are passing from it and it's very widespread. It seems pretty rare considering the number of cases that we've had in the city. But we were found that this is a possibility. It's a possibility that some kids that there may be like a vasculitis component in children. I don't think it gives us more information, and it helps us have a better understanding of what the case presentation can look like and things that we should watch out for and monitor for. But I don't know if it changes the trajectory overall.
And I think like what it will be significant in doing is like delay, like I think it's going to solidify though a little bit, like not reopening the schools until September.
Yeah. There's a lot of time between now and then. And hopefully things do get better, and at least in our jurisdiction, you know, things can get under a lot better control, and we can actually start like imagine what it looks like to reopen things on a broader scale. But we just have to like keep it up, like just keep reassuring yourself that, trust me, this is so much better than we were. Like when we were getting reports of 800, 700 deaths a day in the city. And we have people in the chat right now, you know, we have a nurse in the chat right now who she's working in NYU tirelessly out there taking care of sick people, and, you know, checking in with her and hearing about, you know, all these levels of ICU level care that was going on, and entire hospitals were, you know, they were just COVID hospitals across the city. And so now that we're to the point where some of these hospitals are reopening, people are going in for other things, some clinics are reopening. We're in a good place, but we're far from, you know, where we need to be. We still have the lacking resources for the personal protective equipment, and a lot of essential people are still missing it in, like, you know, in outpatient surgical procedures, sometimes that do surgical emergencies, some emergent dental procedures, a lot of things that people may have not thought about or forgotten are still very resource poor. So we're not out of the thick of it, but we're definitely making a lot of good moves forward.
And I did also want to like see if Allison felt comfortable. So she is a nurse who's been working on the COVID units for a few weeks now. Like, Allison, I don't know if you feel comfortable like sharing a few words of like what it looks like now on some of the COVID units that you've been working on.
Take it off mute if you want to. Oh, can you? I think Lily has to do it. Okay. Oh yeah, go for it.
Hi.
Hi.
So, like Julian said, it's much better. I'm now officially the unit. So I normally work outpatient in a adolescent and transgender clinic, and my background before that though was in acute care. And so I got redeployed to the hospital and was on a COVID unit. My hospital went from like 600 beds to about 1,100 in a matter of 2 weeks. And we are now closing units, some of the COVID units, and I got to go back to my normal job.
Yay!
Kind of.
Okay.
Yeah. So what we're doing, okay, thank you. I know it's really good news. The one thing that we're doing now though is we're the only pediatric center testing kids and young adults. So now I get to test once a week, which is, as Julian said, the nose swab is not the most comfortable thing. So
yeah.
But we're starting to do procedures again. So it's really exciting. Some of the adolescents that have been waiting to get top surgery and stuff and have really like been delayed in care are finally going to get their surgeries,
oh, wow.
Which is really great. And yeah, I mean, we're still over, I think we still have 100 beds of ICU, which is significantly more.
Yeah.
And they've upped the ECMO, which is the treatment for that you might have heard about. So I think we've got like 35 people on ECMO right now. Yeah. Or we're
and so just so people know, ECMO is sort of like taking over for your lungs and your heart. I don't know. And so these are like,
it's advanced life support without getting too technical. Advanced life support. Yeah.
But if anybody has any questions, like I can try to help, or I can tell you about my normal job. I can talk about COVID and treating people and what it looked like in the hospital. I'm happy to do either. So.
Maybe we can do a follow-up and have you talk a little bit about some of the positive stuff. I think I read that I think would be a powerful thing is back in, if there was a terrorist attack or something, we would know everyone's name. Everyone's name would be published and there would be all these memorials, and we're not getting that anymore. And I think a lot of the humanity of it is taken out of it, has been removed because it's so isolating. And I think people are just all in this collective shock. And I think that would be a powerful thing if even people could just say their names and have people, talk about the person that they lost so tragically and dramatically.
I mean, I think what you were talking about though is like, so thinking about privilege and everything about this is that, and checking your own privilege. I mean, my experience of working on a COVID unit is so drastically different than some of the other nurses, right? Because I work at this in really well-funded, really well-respected, very high-tech hospital. I worked in the newest hospital that was built in the city. I mean, I could get into all the technology and what I have access to as a nurse, and the patients have access to. And so my experience was that of somebody who had a ton of protection, a ton of ability to protect myself, protect my patients, and do it do this pandemic care. Not to say it wasn't scary, and trust me, it was a very traumatic experience still, but the nurses at Brooklyn Hospital or Elmhurst Hospital have had such a different experience. And I think, you know what I mean? And I think that's something important in healthcare to think about, that people need, but
we have to talk about it, the disparities.
Yeah. And it's like, I don't know. So I don't, it's like, I don't know. That's the way I feel about it. I feel very lucky for where I work, where I was during this.
But your story and experience is still valid and worthy of sharing. And even if that was your experience, it's still valid, and it's still humanity in that. And you should speak that truth regardless of if it was a nice hospital or not.
It's a really
okay. Yeah.
It's a really nice hospital.
Yeah, but it is what it. We can talk about dismantling these systems later, but I think with what you had, I think you did the best with what you had, and you were lucky. And I think speaking, acknowledging that other people didn't have it as lucky is also part of that too. But don't feel bad for sharing, for having that experience, because that is scary.
Yeah.
All right. I don't want to hold us too long, because I know it's supposed to be like 40 minutes.
Yeah, I think we went over, but thank you so much. It's absolutely, this was such a precious time for us. And thank you so much, Alison, too. Would love to maybe have a follow-up. Would be really interesting and I'm sure useful for many people to know. So maybe I'm gonna get your contact through Carlotta and Julian afterwards.
Sure. These two are some of my favorite people, by the way. I was very lucky to work with them at BSTI, and so yes, I just want to say that.
They're becoming some of our favorite people too. We love them so much. So if there's no questions, we can close it, and all of these will be on YouTube as early as I can put it together and edit it. So hopefully by the end of today, it's going to be on YouTube, and then I'll share the link so people can always refer to it. And I'm going to also put the link to anything that you guys want me to add in case on the thread on the YouTube.
Okay.
And I think I speak from everyone, thank you so much for the work you do. It's so fundamental for, if there's a reasons why we're coming a little bit up, it's because of people like all of you that are working right there. So thank you, seriously.
Thank you for that. Appreciate it.
Yeah, and thank you for letting us have like an avenue to express some of what we've learned and what we continue to learn during this time.
Yeah.
Of
Agreed.
course,
Yes.
anytime. Okay.
Thanks.
Thank you.
Bye,
all.
guys.
Thank you.
Be safe
Take
out
care of
there.
yourselves. Take care of your loved ones.
Bye.
Bye.